Medical Director for Emergency Preparedness. The organization takes emergency preparedness very seriously. I've been in this role for about 12 years, and through various threats, H1, Zika, dengue, and Ebola, that really ramped up our efforts to prepare for these types of things. And we take our role in the community very seriously as far as being prepared for situations like this. We have a cross-functional team of professionals that assist with training, protective equipment, protocols for managing patients and the inpatient side. And these help us respond effectively and ensure consistency across the organization. Currently, our task force has been active and been preparing for several weeks for this event.
So what should people do if they believe they possibly have contracted COVID-19? What are some things that we're advising folks in the community?
Well, primarily, the symptoms are going to be fever and a respiratory illness, such as cough. And so they should be reaching out to their healthcare provider to see what advice is given and what the best mode of action is. If symptoms are serious, you should seek medical attention immediately. We're looking at this patient population as serious or not so serious, and we're advising them on a case-by-case basis. But overall, most cases of the COVID-19 are mild fever and respiratory symptoms.
So I'm sure a lot of us, have group chats, text messages, family members, friends that are asking about it. If they believe that, they have potentially something and they come to us, what are we advising? How are we handling potential cases that are coming to our facilities?
Well, Baptist Health across our entities have a screening process at the entry points, including the ER and urgent care facilities, for pneumonia-like symptoms and particularly fever and respiratory complaints. Once we identify that, they're moved to a triage area, and where an in-depth interview for travel history will take place. And we would identify and isolate patients that meet criteria for that. And then with guidance from the CDC and the health department, we look at managing any potential cases.
You mentioned travel a little bit, so if we can expand on that just a bit. So if there's a person maybe without symptoms but has traveled to an affected area, what should they do?
We would be happy to interview them. If they don't have symptoms, that's where we have been making use of our telehealth partners, and Dr. Mishkin can speak to that.
Okay, great. So Dr. Mishkin, we'll get to you in a minute and talk more in depth about our telehealth platform. Dr. Braden, just to wrap up a little bit on your piece, I want you to talk about the protocol for patients who potentially are confirmed. And I should mention that right now there are no confirmed cases at any Baptist Health facility right now. But potentially, what is our protocol, or what do we have in place for patients who potentially are confirmed in the future?
That's correct. That's potentially confirmed, because the confirmation process right now does take some time. But we do have patients under investigation, and that's where we coordinate with the health department. After we go through the travel checklist, their symptoms, we relay that to the health department, and we, in a collaborative effort, look at whether they will be considered for testing. And we obtain the samples, send them to the health department when they deem that they are a patient that should be tested.
I know Dr. Marty will get into this also, but could you kind of briefly talk us through what's the best way to protect yourself?
The best way in the general public to protect yourself, because this is a droplet-borne disease, is by contact with objects that someone else has touched. And that is primarily the biggest way of transmission. Doorknobs, railings, things of that nature. The masks in the general public actually provide little help They're primarily useful in a hospital setting where you're in very close contact with patients that are found to have illnesses of many sorts. But in the general public, there is very little droplets that are in the air because they settle rather quickly and don't spread more than 6 feet. And these are in conjunction with the CDC guidelines. So hand sanitizer, gloves, washing your hands for 20 seconds is really the best way to help slow the spread of this.
Thank you, Dr. Braden. Dr. Perez-Fernandez, I want to ask you a few things. We understand that COVID-19 can present with pneumonia-like symptoms. You know, that's your area of expertise. Can you tell us a little bit about who are maybe the folks who are most vulnerable, and walk us through some of the folks that maybe are at higher risk?
Sure. Thank you, Jordi. Good morning, everybody. I think it's important to mention and echo the words that Dr. Braden had said. Though this virus behaves with respiratory symptoms, most of the patients suffer very mild symptoms of a respiratory condition. So the vast majority of the patients that are affected with the COVID-19 are only presented with cough and fever, and the respiratory symptoms don't go over that. For those patients who develop pneumonia, which is a condition that will fill your lungs with inflammatory substances such as some fluid and some bacteria or virus in this case, those patients might be affected in different degrees of severity, and most of them, very luckily, have been behaving also with mild to moderate disease. So they don't become what we call respiratory dependent or dependent on any particular supply or sustainability. So they are recovering, and they're recovering well. Now, when those patients, the ones that really have more chances to develop problems are those who have been infected with comorbid diseases. And what we call comorbid diseases, we speak about conditions such as respiratory baseline conditions such as COPD or even complicated asthma cases, or patients who have other diseases such as diabetes or even cancer or recovering from lung cancer. Those are the population that we call at risk, and that we've seen based on the experience that we have with COVID-19. Those are the ones that really can or are exposed to more complications.
Excellent, thank you. And for the Spanish media who's in the room, we'll loop back around with Dr. Perez-Fernandez and go through this in Spanish as well. Dr. Marty, thank you for being with us and joining us here today, our partners at Florida International University. Can you talk to us about some of those specific symptoms that are linked to COVID-19?
Thank you, Dory. Yes, and first I want to thank Baptist Hospital, and I'm so pleased with your outstanding preparations and plans for this very serious situation that we all find ourselves in. So you asked specifically about signs and symptoms. Dr. Perez-Fernandez and Dr. Braden are correct. 80% of the cases that we've seen are either mild or moderate. And by mild, we're talking about someone who may have fever, may have the sense of being unwell. We call that malaise. We have muscle aches, and we have a dry cough. Not a productive cough, generally, but a dry cough. And so that's your mild cases. Your more moderate cases, which fit into that 80% of individuals, have what we consider like a walking pneumonia. Not the type of pneumonia that lays you flat, but the type of pneumonia where you're just that much more uncomfortable, and you start to have this sensation of a shortness of breath. Following that, we have about 13.8 to 14% of the people who present with severe disease. These are people with much more notable pulmonary symptoms. They have, many of them develop a condition that we call ARDS, acute respiratory distress syndrome. And those are harder to treat, and those are the people who require hospitalization. Then the last collection of patients, about 7%, a little bit less than that, present as critical. And these individuals not only have these serious respiratory problems, but they also may manifest multi-organ failure, particularly problems in the kidneys and liver. And that is a serious condition and much harder to treat than the severe cases. There are other symptoms that we see in individual patients that are less frequent than the ones I've mentioned. Some people will have headache, some people will have nausea, some people will have vomiting. very, very, very rarely do we see people who have any kind of a runny nose. That's really not a feature of this particular disease. So we have to think of this more as a respiratory disease that has a certain degree of gravity. Yesterday, the head of the World Health Organization, Dr. Titus, expressed that the current overall world fatality rate for this is about 3%, a little bit over 3%. And that's significantly higher than the numbers we've seen before. But we have to bear in mind how each country is doing their testing. Throughout many parts of the world right now, China included, Germany included, the testing has been to test every single possible case, period. In the United States, up until last week, we had no protocol for testing community-acquired cases and had to beg the CDC for permission to do that. They changed their protocols and they allowed us to start testing, but only the severe and critical cases. Because of that, it looked like the U.S. had a 7% fatality rate. We do not. The truth is, we have many cases that are in that mild area. Thank goodness, yesterday, finally, towards the evening, the federal government has authorized clinicians who, based on the signs and symptoms and travel history of the individual, and whether or not they have any connection to any other COVID-19 case, if they present as a COVID-19 case, we can now do testing on those individuals. That will radically change, and yes, it will seem frightening because we're going to have higher numbers. But that doesn't mean that the situation in terms of its risk has changed at all. What it means is that we're being realistic, and therefore that we're going to be confronting this in a much more realistic fashion. Moreover, it enables us to finally be able to do appropriate contact tracing and containment of this outbreak, which is the best solution that this world has for what is, in effect, a common human enemy. Regardless of where we're from or who we are, this is a common human enemy. Moreover, if I may say one more thing, the rate of risk for this absolutely increases with age. People 18 years old and younger have constituted less than 2.4% of all cases worldwide. Infants, those under a year old, have not needed mechanical ventilation, have not needed care in a pediatric intensive care unit. They have done remarkably well. We have not even seen any deaths in that age range. The seriousness goes up as we get older, to the point that someone 80 years old, depending on which study you look at, has no other comorbidities, has a risk of death between 14.8 and 21%, simply for being that age. We here in South Florida have an aging community. We have a lot of people in their 50s, 60s, 70s, and 80s, and so we have to be particularly attuned to that reality.
Thank you, Dr. Marty, for that. We also kind of want to learn, you've traveled the world and been through Ebola and lots of other things. Can you share with us some best practices for protecting yourself? Tell us, the face mask, do we need a face mask, do we not? Share some of that insight, that would be great.
Well, first, again, let me congratulate Dr. Perez-Fernandez and Dr. Braden, because the information they already gave you is correct. Let me add to their information and say that it is very important that we be hygienic. The good news about this virus is that it has an envelope, and envelope viruses are more sensitive to most any cleaning ingredients that we can use, most any easy over-the-shelf. So by cleaning surfaces and keeping surfaces that are frequently touched clean, we're going to reduce spread. That's very, very important. Number two, we have to do personal hygiene. And by personal hygiene, I don't just mean washing your hands, although that is incredibly important. I mean being attuned to what you're doing with your hands on a regular basis. Because if you wash your hands, then touch a contaminated surface, and then touch your face, you've basically defeated the purpose of having washed your hands. So you have to be attuned to what you are doing physically with each and every moment, really, if we want to reduce your risk. And that includes that it's time for a little bit of social distancing, something that we say every year about influenza and something that unfortunately people don't pay as much attention to as they should. So do the fist bump, do the elbow bump, don't do the handshakes. Seriously, it's not the time for shaking hands. That's just a brilliant way of communicating not only this virus, but many others. The other thing are practical things, very practical things. We know there are things that we do that increase or decrease our own body's ability to combat any infectious disease. So let's do those things that make us less susceptible to this virus. What is that? Eat healthy, nutritious foods in appropriate quantities. Not too much, not too little. Exercise every day. If your knees can tolerate it, take the stairs. Don't take the elevator. Park your car further away. Get those steps in. That's important. The next thing is get a good night's sleep. Sleep rejuvenates your body and enhances your immune system tremendously. Those are the things that increase your immune system. Things that decrease your immune system that you want to avoid include things like smoking. Smoking damages the ciliary cells of your respiratory system and makes it, if you smoke, it's harder to get rid of any pathogen that's in your airways. What else should you not do? Try and not stress yourself, because any stressful situation at all, whether it's an argument with your loved one or maybe riding an airplane might be stressful for you, those sorts of activities increase your cortisol levels, and as they do that, they decrease your immunity. So don't do that if that's stressful to you. Or counter that by doing meditation. Do the kinds of things that reduce your stress. That's very important. Do the kinds of things that enhance your immunity. That's very important. And be mindful of the people around you. Yes, it's true that if you're a 20-year-old female, your risks from this disease, if you get it, are very low, because the males have a higher risk than females. We've established that, and we also know that the older you are, the better. But you're going to be a potential source for people who don't have your age, your gender, or your state of high immunity. So be mindful of the people around you. So social distancing is also very important.
Thank you, Dr. Marty. Great insight and great advice there. We're going to shift over to Dr. Mishkin, who is our medical director for Care on Demand. Care on Demand is a telehealth app that Baptist Health has on your phone where you can essentially visit a doctor 24/7. So what should people know about Care on Demand, especially if they're concerned about cold-like symptoms which could be treated for COVID-19? Are we seeing people using the telehealth platform, and what insight can you give us?
Thank you all. Good morning, Georgie. So we all are aware that telemedicine is a alternative to seek care without having to physically go into a doctor's office, an urgent care center, or a hospital. At the current moment, we recognize that a lot of patients with certain symptoms are specifically concerned whether or not they were exposed to this virus. And so our telehealth platform specifically is undergoing an approach where we want to be accessible to the community to advise patients and their family members about their symptoms and potentially what to do next. As Dr. Braden and Dr. Marty just mentioned, the first thing that many patients are asked by someone after they expose symptoms is go talk to your healthcare provider. And for a lot of patients, there is potential access to do that, but for many there are not. And so we feel that for telemedicine, this is a great alternative for patients to seek care with our providers who have been trained and are following surveillance guidelines and CDC protocols to advise patients on next steps. In addition, many patients are also concerned about other conditions they're experiencing and potentially putting themselves in harmful environments to treat things that may not be related to this current virus. And we want our patients also to use our telehealth platform to seek care specifically for those issues, to reduce exposure and potentially not to get more critical, so we can have a handle on those issues as well.
Thank you, Dr. Mishkin. You mentioned the health department and the CDC. So are we kind of connected in terms of our telehealth platform with those official authorities from Health Department and CDC?
Very much so. Our providers are trained to basically give information that is in accordance with the current CDC and Department of Health guidelines. We are updating this daily, and we're in communication with our team to make sure we're giving the community the best advice per all these recommendations. We want our patients to use this platform because we know it's safe, it reduces their exposure, and will give them an opportunity to relieve that, potential fear and anxiety that they may have without having to do something that may not be in their best interest by going to a facility or or delaying care. And so those are the types of things that we really want to educate the community on right now with the use of telemedicine.
Thank you, Dr. Mishkin. We have a few questions coming in from our Facebook Live viewers, but if we can take a moment, Dr. Perez-Fernandez, and summarize, no pressure, a little bit of the information that we're talking about here today in Spanish, that would be great.
So, voy a cambiar al lenguaje español y vamos a resumir un poco lo que mis colegas han dicho.